Good evening, everyone. I warmly welcome you all to this important talk show on lung cancer awareness, centered around the theme early detection and lifestyle intervention for better outcome. Today's session is not just another discussion, it's a collective effort to bring clarity, hope, and actionable awareness to a condition that continues to take countless lives. Often because it is detected far too late, lung cancer is one of those diseases where awareness truly becomes a life-saving tool. The earlier we recognize the risk factor, symptoms, and preventive measures, the better the outcome can be for patient, families, and for society as the whole. This initiative is supported by Roche and brought to you by IHW Council and is who have been consistent contributor to the cancer awareness and patient-centric initiative. Their commitment to a strengthening and patient-centric initiative, their commitment to conversation around early detection is something we deeply appreciate. I am Samiksha Singh and I will be moderating this discussion. We are honored to have with us Dr. Chirag A, Director of Department of Hemato-Oncology at Apollo Cancer Center, Ahmedabad, a highly respected clinician who have dedicated years to advancing cancer care, precision medicine, and patient awareness. Thank you, Dr. Shah, for joining us today. With what, let's begin our conversation and help our audience to understand lung cancer more deeply, more clarity, and more compassionately. So, my first question over to you is, what are the most significant risk factor contributing to lung cancer beyond smoking?
Right. So I think today everyone is aware that smoking is not the only reason, and in the winter time especially, the air pollution discussion is anyway all over the country. So apart from smoking, air pollution is the biggest risk factor. As we know, the air pollution is having many carcinogens from uh, the diesel fuel and other fuels, the many other PM 2.5 particles. So several chemicals in the air from various sources lead to a risk of lung cancer. In the rural areas, there is also much less now, but still some places the use of wood or coal burning, which happens inside the house, and that is also a contributor. On a smaller level, there is asbestos exposure, which again has gone down in the industry use, but still it is not zero. And the another one which I think important is the second-hand smoke. So people who are themselves not smoking, but they are exposed to second-hand smoke is also important. And this may be a lot more important for children and women because inside the home, uh, and when at very young age children are exposed to this, smoke, second-hand smoke, they are at particularly higher risk.
Thank you, Dr. Shah. So, my next question is, how can we better educate the public on early warning signs and risk factor to promote early detection?
Right. So, I think the most important point here is to be aware of your body. So, people always want some very, very specific signs for cancers. But for most cancers, there are not something very specific signs which tells you that this is cancer and this is something else. So a lot of overlap is there among the symptoms. So the most common symptoms of lung cancer are a cough, which is obviously a very common
Very
symptom.
common, yeah.
And then there could be low-grade fever, some chest pain, weight loss, difficulty breathing. In more advanced cancer, If it is pressing one of the nerves here, then there can be hoarseness of voice. And if it is spread, then it can cause symptoms of whatever area where it is spread to, like bone pain, for example.
Right.
But what I tell everybody in such awareness meetings is that you have to understand that if any new symptom in your body, say in this case cough, is going on for more than 3 to 4 weeks, then it needs additional evaluation, because up to 3 4 weeks you should not start thinking about cancer. The reason for this 3 to 4 week timeline is that this is when the most of the self-limiting illnesses would go away. So seasonal coughs or anything allergy, these are likely to get much better in 3 to 4 weeks timeline. If
Yeah.
in that period you are still continuing to have issues, then it means that you have something more going on potentially. And in that case, a simple chest X-ray should be done. Traditionally in India, the major pitfall that we get is that people keep on trying lots of different home remedies for cough, and this, if one doesn't work, they change to the next one, like that. The time goes on, and people spend several months doing this. So these are the symptoms, but more importantly, this is how one should look at it.
Moving ahead, what role does environmental exposure, that is, air pollution, occupational hazard, play in lung cancer cases, and what preventive measures should be taken?
So, as we discussed earlier, that air pollution nowadays is an important risk factor, and increasingly so with our all the increase in pollution all around and the climate changes. It is not easy to you know uh, kind of be away from air pollution, but there are
Mhm.
things that people can do. So for people who have a high exposure, such as working outdoor, and in the season where the pollution levels are very high, then they should wear mask. And we can talk about the mask in detail a bit later. But most important is that for those who can afford in their households, they can use HEPA filter to clear the air.
Right.
So that's, I think, the most important. And don't forget the second-hand smoke. Always that the strict enforcement of the no smoking in the office, public places, etc., should be done. And if you cannot stay away, if your friends are smoking, then you politely tell them no, or tell them to do it in a different place.
And how can lifestyle changes and preventive healthcare be better indicated to reduce lung cancer incident, as you mentioned earlier also? So I just wanted to know more point of view from your side.
Right. So in the lifestyle, there is in terms of the allopathy, modern medicine research, we know very little about what can prevent lung cancer. But the few things that we know is that diet rich in fruits and vegetables is known to reduce the risk of lung cancer. Okay. Now, it does not mean that taking vitamin tablets will reduce your risk of lung cancer. This is what many people confuse, that if diet fruits and vegetables, then that means we take multivitamins and we are safe, or we take even high dose multivitamins, even safer. Okay? But that is actually the other way around. And there are multiple studies to show that high dose vitamins are either not beneficial or actually harmful. So there was one very large study in US where the high dose beta carotene actually increased the death rate in patients, in people who develop lung cancer. So higher incidence of lung cancer and higher death rate. So any kind of high dose multivitamin for any purpose of health whatsoever is not useful. Okay? The US Preventive Services Task Force, which puts out guidelines every few years for the US population, has never recommended multivitamin of any sort for any health benefits. And particularly, I would say that for high dose vitamin, that has to be very, very clear. That should be avoided. We can say that in India, the diet is not, vitamins fortified, like the wheat flour is fortified in US with vitamin. So we can say that a RDA, regular, the recommended dietary allowance level of vitamin. So in simple words, multivitamin which has the minimum doses of vitamins is a reasonable thing to take, but none of those high dose vitamins or having many minerals, many elements, 20, 25 like that, those are actually harmful. So I would say that for lung cancer prevention, in terms of lifestyle, diet rich in fruits and vegetables, and general healthy lifestyle are the most important things.
I think overdose of anything is not good for health. So moving ahead, what advancement in screening techniques have had the biggest impact on early detection of lung cancer?
Right. So before we go to that, let me just briefly talk about the mask use, because we spoke about air pollution and use of mask. So a lot of people use these simple cloth masks with lot of fancy designs and fashion in there, but they are not of any use. The simple cloth mask only prevent a clear large droplet exposure. So if somebody coughs or sneezes in front of you and you are wearing a cloth mask, then you will have protection from that major exposure. Other than that, it is of no use for air pollution or any other infection prevention. For the air pollution, you need at least a good N95 mask and with proper fitting. A lot of people don't fit it properly around nose or here, then it would also lose the benefit. So N95 at least or N99, these are the masks to be used for this purpose. Even the surgical masks, the light blue ones that a lot of people use, that is also not useful for the air pollution. That can also prevent the direct exposure to droplet and little bit of infection prevention, viral infections, seasonal things. But for air pollution, you need the N95 or N99 level of mask. So now coming to the screening that you asked about. So the simple chest X-ray does not work for screening, and there are no blood tests for screening. So it is important because we see a lot of people, they do this body profile, see a lot of blood tests done every few months, yearly, and if they are all normal, they think that we cannot have any bad disease.
Yeah.
But that is a very wrong assumption. Most of the cancers, including lung cancer, don't affect blood test until in very advanced stages. Okay? So for the lung cancer screening, the only standard test is a low dose CT scan. And that too has been studied only in the people above the age of about 50, 55, and to be done in people who have very heavy smoking history. So if you have more than 30 pack years of smoking, and if you get this low dose CT scan once a year, then in that study, after 3 years of this, testing. So once a year for 3 times, there was a 20% reduction in the lung cancer mortality. So by picking up early lung cancers, this is not very widely available. So this is a bit practical issue, but in the larger cities, this is available. But you need to go to a good center who are comfortable reading it. In India, we have a significant number of false positive, what we call. That means other infections, tuberculosis, old healed tuberculosis, other old healed infections showing up on the scan, and you don't know what it is, and you may end up doing unnecessary more biopsies and tests and all that. So yes, but people who have access to this test, enough motivation, very heavy smoking history, should consider this low dose CT scan.
Sir, as you mentioned that it is more accessible in tier 1 cities. So how can we increase access to lung cancer screening, particularly in undeserved pollutions?
In the underserved areas, uh, as of today, I think we don't have a way to provide lung cancer screening because we cannot move the test there, the scan machine. But there is a lot of research going on with AI-based screening, where from the chest X-ray, they can pick up very early signs and differentiate better infection versus lung cancer. So as I think that gets more widespread, there is some people who have these tests in very advanced stages, and I believe even commercially available in some areas. So that once widely available could be used in the underserved areas, because doing chest X-ray is easy, and then the reading can be done centrally by the AI.
Right. And so, what challenges do healthcare providers face in implementing widespread lung cancer screening programs?
So again, the availability of a CT scan machine is not very widespread,
Right.
uh, and the people who can read a low dose CT accurately, because if you start doing CT scans without proper reading, then there will be many more additional testing leading to PET scans and biopsies and a lot of anxiety.
Mm,
So CT scan machine availability is increasing, and
mm,
alongside that, the if the radiologist get more training,
mm,
then more and more people can start implementing the
mm.
low dose CT screening with
Right.
a certain standard criteria, and there should be availability of further follow-up testing for that also. So it should not
Yes.
be that you just do the low dose CT and the next steps are not available. So
Sir, can you discuss the role of multidisciplinary care in managing lung cancer patient?
right. So lung cancer is treated by surgery, radiotherapy, chemotherapy, immunotherapy, targeted therapy. So there is definitely a very big team required
Mm,
to provide ideal treatment options to a lung cancer patient. The Say for example, if you have a early stage lung cancer, now stage 1 or 2, now it is operable, then earlier the plan was just to operate. But
mm,
now there is clear data that giving immunotherapy based treatment before the operation further improves the overall cure rates.
right.
So Similarly, in stage 3 lung cancer, you have the option of combining radiation and chemotherapy.
Mm,
So for all these decision making, then we need to work with the multidisciplinary team where the surgeons, radiation oncologists, medical oncologists like me, pathologists, radiologists, all these people are talking and taking joint decisions.
right. So I think very thoughtful answer. So moving ahead, how do we ensure that patient diagnosed with lung cancer receive the psychological support they need throughout their treatment journey? Because cancer is something which drain your mental health also a lot.
Right. So very true. And for lung cancer, even more so, because
Mm,
even today, the large majority of lung cancer are still diagnosed in stage 3 or 4.
mm, mm,
So, the role of psychosocial support is very important.
mm,
The trained counselors are now available at practically all major cancer centers,
mm,
and their role from the day one of diagnosis is very important, and providing good uh, psychological care and symptomatic care, in fact, has been shown to even improve the survival. So
mm,
that means it is as important an intervention equal to chemotherapy in the treatment of advanced lung cancer. So it's an additional further
mm,
improvement in survival. So we need trained counselors for this,
mm.
and the psychologists are available now at most places, and more people should avail their services. So where they are not available in the hospital, online services are also available for many counselors.
Right. And so, moving ahead, I want to know because we are also doing an awareness. So, like this, what are some examples of successful patient advocacy initiatives that have improved outcome for lung cancer patient specifically?
So, I think patient advocacy in India for lung cancer is still in very limited stages.
Mm.
And there is a lot of general advocacy awareness going
Yes.
on, and that definitely has led to more and more awareness. Early diagnosis has become more important, more common. When I
Mm.
started practice about 20 plus years ago, practically everyone was coming in fourth stage, whereas now we see some early stage cancers, about 10-20% are now early stage lung cancers. And the
Mm.
other important aspect I think that it has helped is the overlap with tuberculosis, because a lot of the symptoms of lung cancer are similar to tuberculosis. And when we started practice, we saw a lot of patients being treated for tuberculosis for several months before getting a biopsy. Because when they see, for example, pleural effusion, fluid in the lungs, or some lymph node here, and cough and low grade fever and weight loss, the doctor would start treating them for tuberculosis
Right.
without a biopsy. And they would be treated for several months, 3-4 months. When they don't get better, in fact, they get worse, then they are referred to us or to the lung specialist, and
Mm.
they get further diagnosis.
Right.
So, whereas now this has become much less, and I would again like to emphasize that uh, uh, without a confirmed diagnosis of tuberculosis, one should not start treatment nowadays, and that a diagnosis of TB is also widely available. So now the days are gone when people should be starting empiric TB treatment without any confirmation. This would actually prevent a lot of lung cancers from being, diagnosed late.
Right. So I wanted to know also from you, how do you think about this? Like, what can policy makers and government do to enhance awareness, campaign, and lung cancer prevention efforts?
So, I think the efforts are ongoing by government and NGOs, and definitely like your organization. And more can be done. It's a very large country, and I think the issue that we are facing is the air pollution. And
Right.
for that, more awareness is required that the use of mask, use of better mask, and when to avoid outdoor exposure, what um, uh, to do, of course, to reduce the air pollution, but that requires a much larger scale efforts, and everybody can put in their own efforts into that. But while we are talking about individuals, what they can do is the better use of the awareness of which days the air pollution is higher and accordingly reduce the outdoor exposure,
Right.
especially for children and those who are at risk. And that should help a lot. Apart from the most important aspect, the reduction in the smoking, tobacco use, the laws related to tobacco selling to children should be enforced much more strictly, because we see that school children are also smoking, collegians are smoking, and that is where that effort is very important. The data for smoking as addiction shows that the large majority of people who are smokers started their smoking before the age of 30 years. So, if this age group is taken care of, the children and the youth, then the risk of getting tobacco addiction, smoking or chewing tobacco will be much less. So this age group needs to be targeted, and their why they are getting into that habit, their stress level, the educating them, those are very, very important efforts to be done.
So, what are the latest breakthrough in targeted therapy and immunotherapy for lung cancer treatment?
Right. So I think this is a very important area because most of the lung cancers, unfortunately, are still detected in advanced stages. And when I started practice, the median survival, the average survival for these patients was 1 year. And now it is increased to 2 years, 3 years, and for some who where we find a option for targeted therapy, it has even gone to 5 6 years. So there is a huge improvement in the survival. Now, the two major medicine groups for this responsible are uh, immunotherapy. These are medicines which are given as injections, generally once every 3 weeks or so, in daycare, and they enhance the ability of body's immunity, body's T cells to fight the cancer by removing certain, you can say, a blindfold on these cells. The cancer cells secrete a protein which blindfolds the T cells, and this drug removes that and activates the T cells again. And this has improved survival in many ways. One, by in addition to chemotherapy, but also for some people where chemotherapy is not an option, this is an option because this is much easier to tolerate for most people. The second is the targeted therapy. So about in depending on what group of people you take, about 30 to 50% of people you find a target. So for women, non-smokers, with adenocarcinoma especially, we find a target in about 50 to 60% of patients. And for these people, for example, we do the special tests like NGS panel, PCR. From there, if we find that the cancer cells are expressing certain protein more, for example, EGFR or ALK or ROS, like that, then there are drugs specifically targeting that. So that allows a more focused treatment, and they are generally in the form of tablets. Some are injectable, but mostly are tablet form. So very easy, much less side effect compared to chemotherapy. And those are the ones which have improved the survival in this group of patients from average 1 year to now about 3 years, 5 years, and some latest even 6 years plus. So those are big hopes for the patients with advanced lung cancer.
So, thank you so much, Dr. Shah, for your deep insight and for guiding us through these critical aspects of lung cancer awareness, screening and treatment, and patient support. This conversation has been truly enlightening and a reminder that early detection, timely medical intervention, and a compassionate care can save lives. A heartfelt thanks to IHW Council for organizing this platform and to Roche for supporting this vital initiative. Thank you so much, sir, for joining us today. Thank you.